This is John Garrett Hall performing my IV push for Nursing 130 with Dr. Brooks. For this, I will be using hydromorphone, 1 milligram. Again, I've already verified the 2 checks before I came in. I also performed an assessment on the patient beforehand since this is an opioid, checking their sedation level, blood pressure, heart rate, respiratory rate, any drug allergies, and making sure that they have the appropriate amount of pain for this. The order says as needed for severe pain, so they would have said anywhere between 7 and 10. And then when I drew up, make sure that it's not expired, not seeing any sedimentation in it, it's the correct medication. Again, I come in, hand hygiene, gloves. Hello, Mr. Duck. I'm Garrett. I'm your nurse. I've got your hydromorphone for you. Do you still want it? Is your pain still? Yes, it's still up in the 7 to 10 range. All right. We will go ahead and take care of that for you. And now I can go ahead and get started on the patient. So I'm going to go ahead and pause the primary. I'm going to find the correct Y site. I've already verified that hydromorphone and normal saline are Y site compatible, so we are good there. I am still going to flush this before actually giving the medication. So again, I'm going to scrub for a solid 15 seconds. All right. Go ahead and flush it between 3 and 5 milliliters. Again, checking the IV site for signs of infiltration, inflammation, phlebitis, any pain or tenderness. No? Okay, we are good. Going to aspirate for blood return and then flush again with between 3 and 5 milliliters. Okay, we have a patent IV site. So now I can go ahead and administer the medication. For hydromorphone, says 2 milligrams, needs to be pushed between 3 and 5 minutes. I'm going to choose 4 minutes because it's nice and easy, and I have 1 milligram instead of 2, so I can divide that in half. 2 minutes with 10 milliliters. It's going to be 2.5 milliliters every 30 seconds. Go ahead and start. 2.5 milliliters, nice and slowly. Now I wait till that 30 seconds is up. Okay, another 2.5 milliliters. All good. Again, checking with the patient. Any pain, burning, pressure you're feeling, any swelling? No. IV site still good and patent. Okay, another 2.5. Okay, 30 seconds. Last 2.5 milliliters of this syringe. I'm done with that syringe. I still need to wait 30 seconds to complete because there's still some medication in the line. I'll flush that out with some normal saline. Still waiting that 30 seconds. Now I can go ahead and flush that last little bit in. uh, 2.5 milliliters, and finish that flush. We are done with the hydromorphone. I can go ahead and restart the primary, waiting for the drip. Saw the drip. We're good to go on there. So I'm going to document hydromorphone. I documented that I hung the normal saline. I'm going to document the hydromorphone. And then again, because it's an opiate, I'm going to come back 15, 30 minutes later, and I'm going to verify with the patient, check their sedation level, respiratory rate, blood pressure, heart rate, making sure they're not too sedated. If we need to, because it's an opioid, we can use naloxone as the antidote for that. And then I'm also going to verify that it's actually working. How's their pain level? Is it being brought down to a level that they can tolerate, whether it's 3, 4, anything lower? Or if it's not working, maybe we can switch to something else. And that is my IV push.